Have you ever just wanted to stand up or take a step, but that sharp pain in your knees or thighs stops you cold? Does it feel like your joints are screaming for attention every time you move? If that sounds familiar, then you need to watch this video right now. Because what you're feeling is not just discomfort. It could be a message your body is sending you. Just imagine waking up tomorrow morning without that nagging ache, walking without hesitation, and moving freely again. Sound impossible? It's not. Stay with me, because today we're going to unravel the mysteries behind joint, knee, and thigh pain, and I promise by the end, you'll feel empowered with knowledge that could change your life. Let me tell you about Sarah. She's a regular person, a mom, a working professional, someone who loves hiking on the weekends, but for months, something was wrong. Every step was heavier. The pain in her knees felt like knives stabbing her from the inside. She tried to ignore it, thinking it was just part of getting older, or maybe she had just overdone it that day. But the pain got worse. One day, after a short walk, Sarah thought she might just collapse. She couldn't even climb the stairs without gasping for breath and wincing in pain. That's when she realized this isn't normal and it's more than just wear and tear. If you're watching this with a similar story, you're not alone. This video is for Sarah and for you. Let's start with the basics. Why do our joints, especially our knees and thighs, sometimes hurt so much? Think about your joints like the hinges on a door. When they work well, the door opens smoothly. But if those hinges get rusty, damaged, or don't have enough oil, the door squeaks and gets stuck. Our hinges are made up of bones, cartilage, a cushion between bones, ligaments, muscles, and fluid that helps everything glide smooth. When any of these parts get damaged, inflamed, or weakened out, pain happens. Some common causes include arthritis, the most common cause of joint pain. It's like the cushion inside your joint wears away. Injury, sprains, strains, or tears can cause sudden or chronic pain. Overuse, repeating the same motion too much can lead to inflammation. Aging, as we get older, our joints naturally lose some strength and flexibility. Poor posture or body alignment, it can stress certain joints more than others. Obesity, extra weight means extra pressure on your knees and thighs. Medical conditions, like gout or infections, but knowing the cause isn't the whole story. Because pain tells us more than just what is wrong, tells us how to fix it. You might think, I can just deal with this, push through it, and keep going. Listen, I get it. Life is busy. But pain is your body's way of raising a red flag. Ignoring it can make things worse, turning a small problem into a major one. Remember Sarah? She ignored her knee pain until she couldn't walk comfortably anymore. Don't let that happen to you. Here's something surprising. Movement is actually one of the best things for joint health. It seems counterintuitive, right? If it hurts to move, shouldn't you rest? Well, too much rest can stiffen your joints and muscles, making pain worse. But too much movement, or the wrong kind of movement, that can also harm. The key is knowing which movements help and which hurt. Sarah found her way by learning what movements worked for her body. Some days, gentle stretching was her best friend. Other days, a little walking or strengthening exercises helped her knees feel stable and less painful. She also discovered the power of small daily habits like paying attention to posture, avoiding sitting too long, and listening to her body's signals. Let's break it down into easy actions you can take today. 1. Gentle movement. Try gentle stretches like hamstring stretches, calf raises, or simple leg lifts. Low-impact activities like swimming or cycling can reduce stress on joints. Practice walking regularly, but don't overdo it. 2. Strengthen key muscles. Strengthen muscles around your knees, especially the quadriceps, front thigh muscles. Strong muscles support your joints and absorb shock. 3. Maintain healthy weight. Losing even a few pounds eases pressure on your knees. Focus on balanced nutrition and light physical activity. 4. Posture and ergonomics. Check how you sit, stand, and sleep. Use supportive shoes. Avoid standing or sitting in one position for too long. 5. Use hot and cold therapy. Cold packs can reduce swelling. Warmth loosens stiff joints. 6. Consult professionals. Don't hesitate to see a doctor or physical therapist for personalized care. Sometimes targeted treatment like physical therapy or medication is needed. Remember, joint pain isn't just a discomfort. It's your body trying to tell you something important. By understanding the message and choosing the right actions, you can reduce and even reverse that pain. And just like Sarah, you can reclaim your freedom of movement and enjoy life again. Let's clear up some myths that might be holding you back. Myth 1. Joint pain is just aging. I can't do anything about it. Truth. Many people improve pain significantly with lifestyle changes and proper care. Myth 2. Exercise will make my joint pain worse. Truth. The right exercises can protect your joints and reduce pain. Myth 3. If it hurts, I should stop moving completely. Truth. Movement tailored to your condition usually helps more than hurts. Eat anti-inflammatory foods like fish, nuts, fruits, and vegetables. Stay hydrated. Avoid smoking, which can damage cartilage. Get enough sleep for recovery. After months of small, consistent steps, Sarah saw incredible change. The sharp pain dulled, her knees felt stronger, and her confidence soared. She could hike again, play with her kids, and simply enjoy life without fear of pain. She's not special, she's just someone who listened to her body and took action. And so can you. If your knees, joints, or thighs hurt today, don't wait until tomorrow to start caring for them. The longer you wait, the harder it can be to fix. Hit pause on pain by moving smart, eating well, and seeking support when you need it. Your future self will thank you. If this message resonated with you, share it with someone who needs to hear it. And if you want more tips on joint health, hit the like button and subscribe for regular updates. Your journey to pain-free movement starts now. Not all joint pain feels the same, and recognizing the type of pain you're experiencing helps you respond better. Sharp pain. Often sudden and intense, sharp pain can signal injury, a strain, or even a tear. It's your body's way of yelling, "Stop. Something's wrong here." Dull ache. A constant, dull ache might mean inflammation or arthritis. This pain usually builds up gradually and feels like an annoying background noise you can't quite ignore. Stiffness. Sometimes your joints feel stiff, especially after waking up or sitting long. This stiffness limits movement and causes discomfort, signaling that your joint fluid or muscles need attention. Swelling or warmth. Pain accompanied by swelling and warmth often means your body's inflammation response is active. This can come from injury, infection, or autoimmune issues. Understanding your pain type helps you decide when to rest, when to move, or when to seek medical attention. Many people feel joint pain specifically in their knees and thighs at the same time. Why? Your knees and thighs work as a team. The muscles in your thighs, especially the quadriceps and hamstrings, stabilize and move your knee joint. When these muscles are weak, tight, or injured, they stress your knees and cause pain not only in the knees, but also in the surrounding thigh area. For example, weak thigh muscles allow the knee to shift out of alignment, causing joint wear. Tight hips or thigh muscles can pull on the knee joint, creating tension and discomfort. So, treating knee pain often means paying attention to the thigh muscles and vice versa. Sometimes, the small choices we make every day silently harm our joints. Other times, changing simple habits can be incredibly healing. Harmful habits. Sitting too long. When you sit for hours, especially with poor posture, your muscles tighten and your joints get stiff. Improper footwear. Shoes that lack support or cushioning can add stress to your knees. Ignoring pain. Pushing through pain without adjusting your movement patterns can lead to injury. High-impact exercise without preparation. Running on hard surfaces or jumping without proper warm-up increases risk. Healing habits. Regular breaks. Stand up and stretch every 30 to 60 minutes to keep joints mobile. Supportive shoes. Wear sneakers or shoes designed for your foot type. Mindful movement. Pay attention to how your body feels during activity. Warm up and cool down. Prepare your muscles before exercise and relax them after. Many people don't realize diet can dramatically influence joint pain. Certain foods promote inflammation, which can worsen joint pain, while others help reduce it. Foods that may worsen joint pain. Processed sugars and refined carbs. Excessive red meat and fried foods. Foods high in saturated fat. Anti-inflammatory foods to include fatty fish like salmon and mackerel, rich in omega-3, colorful fruits and vegetables, berries, spinach, kale, nuts and seeds, almonds, walnuts, chia seeds, whole grains and legumes. Adding these foods doesn't just reduce pain. It empowers your body to repair tissues and protect your joints. Pain isn't just physical. It affects your mood, energy, and even your social life. People with chronic joint pain often feel frustrated, anxious, or depressed. They might avoid activities they love or withdraw from friends and family. Understanding this emotional side helps you realize that taking care of your joints includes caring for your mental well-being. Techniques like meditation, deep breathing, or talking to someone can support your healing journey. Sometimes self-care isn't enough, and it's important to explore medical options. Here's a simple overview: physical therapy, customized exercises to improve strength and flexibility. Medications, pain relievers, anti-inflammatories, or joint injections prescribed by your doctor. Supportive devices, braces, wraps, or orthotic inserts can stabilize joints. Surgical options. In severe cases, joint replacement or repair surgery can restore function. Consulting a healthcare professional can help you decide the best combination of treatments for your situation. We live in an age where technology can assist pain management and recovery. Wearable devices track your movement patterns and alert you to harmful habits. Telehealth, access physical therapy and doctors remotely. Apps, guided exercise and meditation programs focused on joint health. Technology can empower you to take control of your pain in a convenient, personalized way. The most important thing Sarah learned was to actually listen to her body. No more ignoring pain or rushing through discomfort. Instead, placing trust in the signals her knees and thighs sent her made all the difference. She learned that healing is a journey with ups and downs, but every step forward was worth the effort. Morning routine. Wake up and mobilize. Start your day by gently waking up your joints. Before even getting out of bed, ankle pumps. Point and flex your feet 10 times to awaken circulation. Knee hugs. Gently pull one knee toward your chest. Hold for 10 seconds. Switch sides. Gentle thigh stretch. While lying down, stretch your quadriceps by bringing your heel toward your buttocks. Hold for 15 seconds. These simple movements help reduce stiffness and prepare your joints for the day. Midday movement. Break the sitting cycle. If you spend long hours sitting, every 30 minutes, stand up and stretch. Reach your arms overhead. Gently twist your torso side to side. Leg extensions. While sitting, straighten one leg and hold for 5 seconds, then lower it slowly. Repeat 10 times per leg. Calf raises. Stand and slowly raise your heels, then lower them. Repeat 15 times to improve circulation. These small breaks keep your joint fluid moving and muscles flexible. Evening routine. Strengthen and soothe. To strengthen muscles and calm your joints, try this routine. Wall sits. Lean against a wall and slide down into a squat position as low as comfortable. Hold for 15 seconds, then stand up. Repeat 3 times. Glute bridges. Lie on your back with knees bent and feet flat on the floor. Lift your hips toward the ceiling, squeezing your glutes. Hold for 3 seconds, then lower. Repeat 10 times. Gentle massage or foam rolling. Use your hands or a foam roller on your thighs and calves to release muscle tension. Warm bath or use a heating pad. Applying heat relaxes muscles and reduces stiffness before bedtime. These strengthen and nurture the muscles that protect your knees and thighs. Your body is unique. These routines are a starting point. Some days might be easier, some harder. The key is to listen carefully and adjust your movements. Pain is a signal, not a barrier. If your joints, knees, or thighs hurt even a little, don't wait until it's unbearable. Start small steps today to move smarter, live healthier, and feel stronger. Share this video with someone you care about who might be struggling with pain. And if you want more easy tips and routines to keep your joints healthy and pain-free, make sure to subscribe and stay tuned. Your journey to pain-free movement begins now. Take that first step.